Hello, thanks for watching. I just wanted to put together a quick video and some slides here for you to reference on your own time to help you understand cervicogenic dizziness and headache that you might be experiencing that is different from vertigo, different from damage in your inner ear, but may still be causing some of your dizziness. How does it work? What is cervicogenic dizziness? What is a cervicogenic headache, right? Your neck has sensors that detect your position, head's position in space, communicates that with the brain, changes in pressure, etc., things like that. Those are going to be in your joint capsules, your ligaments, your muscles, all around in your neck. And when these are affected, the sensors can lose their effectiveness and that communication to the brain. And the result ultimately is headache or dizziness. And it can come from an injury or just gradually with development of arthritis, stenosis or narrowing of the space between your neck. Things of that condition, anything affecting one side of the neck or any of these structures can create some of this headache or dizziness. For the next couple slides, I just have some pictures on here. You don't have to read all of these, but this first one's a good example. There are a lot of ligaments in your neck keeping everything in place. So if these are affected, if one or more of these are affected enough, sometimes you have symptoms, sometimes you don't, but a lot of times when these ligaments are affected, it can create that dizziness or headache. Here's a good example of the muscles going to your head, and highlighted here are some of the suboccipital muscles. So the ones that are bright red, and some of the ones on the side where they come up and they insert on the base of your skull, and you'll feel that big pressure in the back of your head. These can create both frontal headaches and that pain kind of in the back that you can't quite explain. And then I have here just like a model of a little skeleton, and you can see these facet joints along the side. These are a good example of the joints that are going to be affected. So think with this, anytime you go back or turn to a side, you're going to be closing down that space. So some of the tests that I would do or a clinician might do for you to see whether this is creating some of your headache or your conditions is they might bias one of those joints. Close it down a little bit and then have you do some tasks and see if that differs from baseline or if it produces any symptoms. And then you can tell, okay, this side of my neck is causing some of my symptoms. And then the treatments that you're going to do for it and what you might experience if this is the case. A lot of times, aside from the dizziness and headache, your head will feel very heavy and wobbly. You'll want to hold your head in your hands like so just to recover when you're at rest. You may not notice that you do this. You may want to use the back of your chair or a wall to kind of hold yourself up because your head just feels so heavy. You'll have dizziness when turning to the affected side. So if I'm biasing, if it's the right side of my neck here and I'm turning that way, it's going to bias that joint and it can cause some of your symptoms. And treatment for this is going to consist typically like any other neck physical therapy you might have, where it's going to be a combination of neck strengthening and range of motion exercises, and then some manual therapy, so some combination of joint mobilization, massage, after ruling out injuries to make sure it's necessary. So making sure there's no fractures, making sure there's no excessive ligament looseness or laxity to make sure you can do these safely. And then as you perform the strengthening and mobility and make sure you get all of your function back, the headache and the dizziness should go away. I hope that this was useful, and good luck with your recovery.